Hello. I want to explain, clarify, and make clear the difference between a service dog, an emotional support dog, and a therapy dog, because it's so confusing when you hear those words. Everybody mixes them up all the time. It's a totally innocent mistake, but there are a lot of legal ramifications for making that mistake. So, since I get a lot of these clients, I wanted to explain for prospective clients, for people who are interested in having one of these dogs with this very special job, what exactly each one is. So I want to start with therapy dogs because they are actually in an entirely different category. Therapy dogs are dogs who are trained to help many other people. So they go to hospitals, libraries, courtrooms, classrooms, assemblies, and they help kids, adults, patients, the elderly. They are rock solid in their temperament. They put up with noises, touching, crowding, overstimulation to the max with kids screaming and loving all over them and touching them everywhere, grabbing on their face and doing all sorts of things that make us dog trainers just cringe. But dogs are just so saintly and wonderful. And it's such a beautiful thing to see a therapy dog at work. And I think one of the greatest attributes of a therapy dog is that they actually are seemingly missing a lot of the things that are very natural for dogs to be uncomfortable with. They are extraordinarily chill. The best therapy dog isn't necessarily the one who wants to run up to everybody, jump on them, and love all over them. The best therapy dog will just lay down, hang out, and be totally relaxed in any environment. That really seals the deal for therapy dogs in most vocations. So if they are reading assistants, they go to a public library and all the kids get to read to them. It's just beautiful when a dog can walk into a new space with all brand new people and all these fantastic smells, ignore all of that, and just want to lay down and hang out to get rubbed on and just enjoy. Um, so therapy dogs do not have public access rights outside of wherever their job is. So when they are invited in for a shift, and this can be with an organization, and it usually is, occasionally, places will allow a solo person to do this, but most of the time you have to be certified through an organization like Pet Partners or Therapy Dogs. And there are other local organizations with a myriad of names. But very often, in order to get into these places, you have to be certified with an organization that has a good reputation for screening their applicants and preparing them well to be in these places safely and happily. So when when we do therapy dog training, it's about the CGC test that's usually required by every organization, the Canine Good Citizen test, which is required by the American Kennel Club. I'm sorry, not required by, is distributed by the American Kennel Club. And I'm an approved evaluator, as are many, many other people. Um, so if you're not in Santa Fe, there are lots and lots of people all over the country who can absolutely do this exam for you, probably very close to you in your area. Um, when they do the certification process, they're testing temperament, they're testing obedience, and they're testing nerve. They want to make sure that the dogs are not anxious in the environment that they will be working. So, just to recap, therapy dogs help many people, do not have public access rights outside of their visitations, and are trained to pass the Canine Good Citizen test by the AKC and then certified by a therapy dog organization. Full stop. Then we have emotional support dogs. And these dogs are absolutely essential for someone with a disability. They are a pet, but it's like if the person doesn't have this pet, then their quality of life is extremely diminished. So, there are zillions of studies and articles about the benefits of having an animal with you, whether it's a dog or a cat or um, it can be multiple species. It doesn't have to just be dogs and cats. It can be birds, reptiles. Um, but it's a pet. It's not a wild animal. Let's clarify that. The really funny videos of someone's emotional support crocodile or alligator, not a thing. It's a pet. Um, when we have someone who has been recommended an emotional support animal for their disability, whatever that is. I'm not particularly interested in a medical diagnosis. I just want to know that a professional, a psychologist, psychiatrist, has deemed someone to have a disability and recommended that a emotional support animal would be a nice way to help mitigate this disability. So these animals are exempt by law per the ADA from um, and FHA, actually, I think is more specific. The Fair Housing Act, by the way. The ADA is the Americans with Disabilities Act, and the FHA is the Fair Housing Act. So emotional support animals are exempt from pet rent, from pet deposits, from any increased fees of any kind at hotels and other places of residence like apartments, condos. If you're renting a house from someone with four um, units, meaning four houses or more. Um, they all have to comply with that. And most places, I think all you need is a letter from your doctor. And it can even be a general practitioner. It doesn't have to be a psychologist or a psychiatrist, stating that you have a disability and as their patient, they are recommending an emotional support dog for you. Um, that is where emotional support dog rights end. They used to be allowed on flights, and I know most, if not all, airlines have cracked down on that because the airlines were confused about the terminology as well. The airlines didn't know the difference between service dogs, which I'll get to in a minute, and emotional support dogs. They thought emotional support dogs were trained for public access, and they are not. They are not task trained. They do not perform anything in order to help the person with a disability. They are simply comforting, and that is an essential part of someone's quality of life when they have a disability. So, um, that is where emotional support dogs end in terms of rights. When I train an emotional support dog, very often what I'm doing is helping them to be somewhere that pets are not always allowed. So again, if a landlord has four units, so either four apartments or four houses or four condos or more, then they are subject to the laws of the ADA and FHA. And um, they cannot uh, discriminate against someone with a disability just because they have an emotional support animal. So if they have a dog in, if my client has a dog in one of these units where pets are not usually allowed, sometimes people will complain because they'll hear the dog barking, the dog is territorial, or the dog is experiencing separation anxiety, especially when they first move in. That's very, very common. So when I'm training an emotional support dog or any other animal, it's to help them not be a disturbance in a place where pets are not usually allowed. I do not task train emotional support dogs. I do not train them to help mitigate the disability. That is a service dog. So let's go to service dogs now. Service dogs take about 2 years of solid weekly training. It is an immense undertaking. It is expensive. It is hard work. And the reason for that mostly is because of the public access training, which is an extremely high level of obedience, and the task training, which is like the equivalent of extremely advanced trick training. Um, when I train service dogs, I've worked with many different kinds. I've worked with diabetic alert dogs, anxiety alert dogs, depression assistance dogs, hearing alert dogs. The only dogs that I will not personally work with start to finish, I will polish after a program, are the seeing eye dogs. And the reason for that is seeing eye dogs have such an intense job, and they require such a high level of training to be consistent enough to be safe for their charge, the person that they're helping. I do not think it is reasonable to expect that to happen with owner training. And I don't personally board and train dogs, so I can't do a seeing eye dog from start to finish. Um, Most of the time, I don't think any other trainer who is working with board and trains should do seeing eye dogs either. I think seeing eye dogs should be with one specialized trainer who has done this over and over with dogs. And especially this. So it's kind of like an assembly line. We're so familiar with this particular pattern that it is almost effortless. It's a very familiar strategy. It's a very familiar process to this person, and the dog gets this person the whole time. That is very rare to find outside of a program. So, when someone says that they want to train a dog to be a service dog, one thing to be aware of in the United States, this varies by country, but in the United States, it is a federal law that there is no registry, there is no certification. You do not need anything to say that your dog is a service dog at all. I don't exactly agree with this in the way that it's been implemented, but I'll explain why it is the way it is in a second. When people call me and ask me to certify their dog as a service dog, I will not do that. I will never do that. Even if you are my client and I have been working with you for years, I will not certify your dog to be a service dog because it's not a thing. It's illegal to ask to be a thing. And if I start doing that, which a lot of people are, and it drives me bonkers, um, then I'm making it harder for legitimate teams who, and this is why, can't afford a registration, who are not working with an organization to certify their dog, who have owner trained, meaning they've taught themselves how to teach their dog to do everything that they need to do for them. And, with people who have disabilities, if they're on disability welfare, if they are, living with family and just struggling to make ends meet, it is not uh, fair or realistic to charge these fees that these fake scam companies are charging. They're charging between, $70 and $300 for a piece of paper that has no legal standing. I could print that piece of paper with my own logo and it would mean just as much. It would cost me, what, a penny for the paper and the ink. It is useless. So please, please, please stop supporting anybody who certifies a service dog in the United States, who sells you any kind of equipment that claims that the dog is certified. So don't get badges that say your dog is certified. Don't get tags. Don't get the certified service dog patches for the vests. Please stop doing that. Anything that says certified, just it's fake. Don't use it, don't support it, don't. Um, so when service dogs are recommended is for people with various disabilities, like I mentioned, who are so disabled that they need a service dog to mitigate the disability. So this is where task training comes in. Um, there are zillions of very clever things that we can train dogs to do to help people with disabilities of all kinds. It does not just have to be a physical disability, it can be mental illness related as well, psychiatric, neurological, things that don't look like the person is disabled, epilepsy, seizures, anything like that. All disabilities are valid, and all of them may, not necessarily will, but may warrant a service dog. So again, all I look for is that mental health or a specialist or your doctor recommends that you have a service dog because you have a disability. I don't need to know your medical information. It's helpful if I know your symptoms so that I can train the dog to mitigate them. Besides that, you can share with me as much or as little as you like. That is your personal information and it will remain 100% confidential. Um, so service dogs do have public access rights. They can fly on planes in cabin with their handlers. Um, Service dogs can go anywhere the public can go. What I recommend my clients do is not abuse that. So I never recommend that my clients take their service dogs to zoos, for example. Um, Legally, can they? Absolutely. The public can go, therefore the service dog can go. However, putting a service dog where wild animal predator scents are is, or can be at least, is likely to be somewhat stressful. And it will absolutely excite at the least, upset more likely the animals at the zoo, which definitely, if they are behaving upset or overly excited, will bother the service dog. And training them to be bomb-proof is hard enough. I don't think it's fair or realistic to put animals on either side of the glass at a zoo in that kind of stress. So, should service dogs be bomb-proof enough to be at a zoo? Absolutely. Do I think that the video on YouTube of the service dog running back and forth in front of the dolphins or the otters, do I think that's cute? No. That is likely a fake dog. If not, it's someone who's being incredibly irresponsible with their service dog. So, um, yeah, service dogs can go anywhere the public can go by law, and that's the ADA again. People at various public institutions are allowed to ask you two questions. They are allowed to ask you if it's a service dog, because we do not, and let me repeat this, do not have to have anything labeling the dog as a service dog. All gear is optional. I find it helpful, but it is not legally required. Um, and then they can also ask you what the dog does. So if you are diabetic, you can just say blood sugar alert. There is no requirement for you to list the specific tasks that the dog can do. You just want to say the category. You also don't have to say anything related to how long the dog has been in training. Many states, not all, so check your local laws. Many states give equal rights to dogs in training as they do to full-fledged service dogs. So what I do is I print out a little info card that has information about ADA laws and state laws and FHA laws so that if I'm challenged in my access with my client or my own dog in a public place, I can point them to the laws that allow us access. 90% of the time, that solves the problem. The other day, I just worked with a local mall who had an illegal policy change, and I pointed out what was wrong with it and what it should be. And it took, 10 minutes of grump, but then we were able to come to an understanding, and they were very appreciative to have the insights of what they needed to change. So, a lot of places are being abused by fakes and frauds, which is unfortunate because those dogs that aren't service dogs and are being brought into places where only service dogs can go before they're ready, obviously, because they're not being trained. They are ruining it for legitimate teams, and the places are getting upset. So when you see a dog who is a service dog on a flexi leash at the end of the leash, not really paying attention to the handler, 90% of the time that dog is fake. If you see a dog being carried, um, and just waltzing around the store, not like holding still and holding the dog, and obviously the dog is working on DPT, um, which is deep pressure therapy. If you see someone just carrying their dog around and they have a little service dog vest on, probably not a legitimate team. Um, what breed your dog is, what size your dog is, actually, for any of these categories, doesn't matter at all. All breeds can be a service dog, all sizes can be a service dog. The issue is the dog is working. So if you are um, just holding your dog and carrying the dog around, what exactly are they doing? Um, most, not all, most tasks require the dog to walk next to their person. Um, so, if you have a diabetic alert dog, for example, it's possible that carrying the dog would not interfere with their job. I'm just speaking statistically. If someone is just carrying their dog around a mall forever, it's probably fake. So I really wish people would stop taking their dogs into grocery stores, for example. Anywhere there is food, a dog is not supposed to be. So anytime we bring a service dog to a restaurant or a grocery store or an outdoor cafe or anything with food, it is really hard when that right has been abused by people who are just using the system. If a service dog or a fake, I have just informed the local mall, misbehaves. So if they are aggressive, if they're disruptive, if they um, are whining a lot, showing anxiety and panting, drooling, clearly upset and distracting or disruptive to the business operations, the shop absolutely has the right to ask the team to leave. That is the safety protocol that is in place for this system that does not require registration or certification. Um, you are to be on your best behavior. The dog needs to be house trained, not to have accidents, will go on command in appropriate places, and can task and not bother anybody. Those are the criteria. If you're not doing those three things, you should not be calling your dog a full-fledged service dog. And if you're not training at all, you don't qualify for service dog or service dog and training status, period. When people run into issues, it's usually around the number of tasks. Um, a lot of people have gotten into this thing where the dog needs to perform three tasks in order to be considered a full service dog, and that's not true. The dog needs to be trained to perform the task. So if the dog does something helpful, naturally, you don't have to train the dog to do this. It doesn't actually count as a task. There must be some level, it doesn't have to be like a hard task, but there must be some level of training in order for it to count as a task. So where this tends to come up is with DPT, deep pressure therapy. And studies show that when we feel the weight of the dog, usually it's on the chest or the abdomen or even on your lap, that will help to lower blood pressure, which helps with stress, anxiety, panic attacks, grounding, all sorts of things. Um, so it is of medical benefit. It's not just cuddling. It is an actual trained task. We teach the dog to position itself, to allow its weight to be on the person until released. So they're not just cuddling for free. They are positioned and they are staying until released when the handler feels better. So when when people say my dog cuddles with me and it's comforting, it's not DPT. You didn't train your dog to position themselves to stay until released. And while the cuddling absolutely may feel great and may help you, it's not a trained task. Does that make sense? So if you do some amount of training for it, it doesn't have to be extensive. It counts as a task. And legally, we only need one task for it to be a service dog. Usually, one task is not enough for the handler. If a handler only needs DPT, it's quite likely that they don't actually have a disability. So they may absolutely have a condition, but if it's disabling to the point that the symptoms are interrupting their life on a daily basis, that's kind of a gray area. I leave that between my client and their doctor, but this is where, task training and having multiple tasks, having enough tasks is kind of like a neither here nor there thing, as long as the client is honest about having a disability. Um, I think I've covered all the things. So thank you so much for listening, and I will see you soon. Bye bye.